Well, good morning or good afternoon, everyone. This is Joy Burkhard. I'm the Executive Director of 2020 Mom. We're so pleased to be doing this webinar today called Advocacy in Action. It's going to be the first of what we hope will be several discussions around maternal mental health advocacy opportunities, and we're pleased to be going over the federal policy platform that 2020 Mom has identified and will be engaged in this year, as well as provide a little overview of what's happening in the states around maternal mental health and what we hope will be occurring in more states. And then we also have a special guest speaker with us, and we'll be doing an interview with Lauren DePaola on the Florida advocacy efforts. With me today is also one of my colleagues, Stacey Porter, who is navigating the slide deck for us this morning. So Stacey, if I can just have you advance to the next slide, please. There we go. And there's a picture of both myself and Lauren. We'll be introducing Lauren in a bit when we get into the conversation about Florida. Before we actually dive into the overview of the federal legislative platform today, we wanted to remind everyone that there's an opportunity to ask questions, provide comments, etc. Throughout the webinar today, and you can do that by using the question feature in your GoToWebinar control panel. So you can see some long gray boxes. One of the boxes says questions, and we'd love to encourage you to open up that box and ask any questions that you have. We are expecting about 100 of you today. It looks like people are still joining us, so just thrilled to have so many of you with us. We'll go ahead and jump right in, Stacey, so we can move into the next slide, please. All right, so we're going to start today's session by giving you an overview of the federal legislative platform that has been identified by our organization, 2020 Mom. And so first we wanted to go into the efforts that aren't tied to a specific piece of active legislation right now, and why we are supporting and wanting to engage our network of providers and advocates and survivors and supporters around these pieces of opportunity. So first, we know that many of you are already aware of the great work and support that women are provided through home visiting programs, and that those programs are funded through the Title V block grant, specifically the McV portion of that block grant, and that funding has been at risk for not being reauthorized. And so we have already been engaged in asking our supporters on social media in particular at opportune times to share their voice about why they believe home visiting is critical for women in the postpartum period, and even during pregnancy. In some programs, women are receiving that support as well. We want to continue to see home visiting programs in states that are engaged in home visiting, and hope to continue in our state work through all of you to look at ways that home visiting programs can expand their reach around maternal mental health disorders, potentially screening, potentially training home visitors, potentially bringing in additional resources, including in-home maternal mental health counseling, for example, which we've been seeing in several programs throughout the United States. So that's a program that we're interested in, and you'll continue to see some efforts and communication from 2020 Mom on that front. That's somewhat temporary, and some of you may actually have more information on the line around where we are from a federal budgetary perspective around McV. So if you do have more information, feel free to add that in the question box, and we can make those announcements later. But we're continuing to keep a pulse on things as well. We also, of course, are interested in ensuring that the Bringing Postpartum Depressions Out of the Shadows Act, which 2020 Mom was a lead behind ensuring that bill passed, with the great work of our advocate and lobbyist, Jamie Belcito, who led this work the last couple of years and made sure that piece of legislation passed. What's interesting about this legislation, because there's funding involved that provides grants to states, we will continue to need to be involved in ensuring that funding is provided on an annual basis. And where we stand right now is that the Senate has authorized $5 million, the House $1 million, and Catherine Clark's office is working directly to ensure that that $1 million get bumped up, and they're keeping us abreast of when we'll have some impact points. Some folks have asked also about the agency that will be identified to provide those grant opportunities to states and where we are with that. And we did just learn that there still is no specific agency that has been identified. The legislation says a department within the Health and Human Services Agency. So we should know more soon, according to Catherine Clark's office. And then just a reminder that state agencies will have an opportunity to apply for those grants. Some of our followers have asked if organizations, private organizations, could apply for those grants. It does not seem to be that will be the case, that the funding will have to go to states, who will then work with other organizations, including private organizations, as they see fit to design their programs and apply for those grants. If you have questions about that, let us know, but we will continue to keep our network abreast of those changes as we learn more and stay engaged on those topics. Good, so those are our federal asks, again, not tied to a specific piece of open legislation. On the next slide, you'll see that there are also a couple pieces of legislation that we'll be supporting. So Stacey, we can go ahead and move the slide. Thank you. So I know many of you are following the maternal mortality review efforts that are happening in states and also being supported now through federal legislation that we feature here on this slide. So many states, or several states, have maternal mortality review committees in place now. The CDC has worked to develop a toolkit and a framework for these states to utilize best practices. And why we're interested in this work, not just because we believe that the cause of death during pregnancy and postpartum should be identified, and that women deserve support during this time, and that we need to work really hard to reduce maternal death and maternal mortality during this time, but also because these committees will allow for the cause of death to be investigated and then reported back up to the CDC. And this will include suicide as a cause of death. As folks may know, we often see quoted in news articles that suicide is a leading cause of death, and other countries are reporting suicide rates, and we just haven't been able to because this data doesn't exist yet in the U.S. in the way that we would like it to. And this structure, this maternal mortality review structure, will allow us to get to that point, track suicide, and be able to indicate and raise up this issue in a powerful way with data to more followers who are interested in maternal mental health. So we're excited about those bills and opportunities. Again, really one package, two different bills. The paid family leave opportunity, some of you may have heard about as well. It's called the Family and Medical Insurance Leave Act, or also known as the Family Act. And this piece of legislation will allow for parents, for example, mothers or fathers, to take 60 days of paid leave, regardless of the size of their employer. Some states do have state family paid leave that may be available to mothers only, for example, and only if she works for a large employer, not a small employer. And so this will really level set the field and allow all mothers and fathers to take at least 60 days, or take 60 days paid leave off for a qualified event, which includes the birth or adoption of a child, and it lines up with the Family Medical Leave Act, those conditions. What we're also really excited about, that this piece of legislation will allow for is that if, for example, a mother did find herself suffering from postpartum depression, for example, after the birth of a child, this legislation would also allow her family members, so for example, her husband or partner or her mother, for example, to take paid time off to care for her and the baby. So we believe that this is critical, as you can imagine, to support women during the perinatal period. So those are, that is the federal legislative policy platform. Unlike the last 2 years, we aren't directly involved in what we would call sponsoring or leading the advocacy efforts on a particular bill. These two bills these efforts are being led by other organizations that we will be supporting and engaged on throughout the year in advocacy campaigns. So feel free to ask questions or share comments or feedback. I'd love to actually hear what you all think about this policy platform through some feedback in that question box. So if you have thoughts right now, if you're excited, still have questions, want to see more on something else, please do let us know, and feel free to add those questions anytime today during the webinar. Well, great. So now we're going to move into, Stacey, you can move on to the next slide. We're going to move into discussing just a little bit about state policy. And this slide, I already recognize that there's a change that we want to make, but this slide really is intended to give just an overview of what some of our states have done in the field of maternal mental health thus far. And there may be a state that we haven't captured here, and if you know of a state that's missing, we would love to hear from you. I think Montana is one that we discovered has had an attempt at maternal mental health legislation in the past that we want to add to this deck. There's probably another state or two that we've missed, and we'd love to hear from you if you know of a state. So you can see that we color code here, and I'm not actually going to read this slide, but I am going to give you a moment just to look at it yourself and give you about 30 seconds here. And if you do have questions or comments, go ahead and put them into the questions box on your control panel. I actually see a couple comments coming in. All right, so I'm going to go ahead and read one of the questions that came in so far. And actually, this question is about the federal policy platform, so feel free to ask questions about that as well. So someone is asking if we are tracking, or if anyone is tracking maternal suicide at all in the United States right now. I do want to say that there are several states that already have maternal mortality review committees. 4 of them, I believe, meet the best practices that the CDC has listed in their joint toolkit developed with AMCHIP and the CDC. I know California is one that's been listed up as a model, the Maternal Mortality Review Committee, and that suicide has been looked at as a cause of death and validated, and there is some preliminary data. What we can do is, I think we'll write a blog post about what we're seeing in those states so far, and be on the lookout for that. So thank you for that big question. All right, I see a couple more comments and questions coming in, so we'll go ahead and answer those. Virginia, thank you, Sean, is saying has a maternal mortality review committee and process in place as well. Thanks for sharing that, Sean, and I think we'll make sure in this blog post that we write that we'll cover all of the states that have a committee and which ones may be tracking and reporting publicly their maternal suicide rates. Great question. Okay, good. And Carrie's already talking about state legislation. So Carrie, we're going to jump into recommendations around state policy platforms soon. And then people are just saying they're excited to hear more about maternal suicide in a blog post. Great. Well, let's go ahead and move on to the next slide. So we wanted to share that based off of attempts last year in states to address maternal mental health in some way, and also based off of risk data that an organization called Sage Therapeutics is looking to publish soon, we have identified 5 priority states. And when we say priority states, really every state is a priority. But because these states have attempted to address legislation in the last session, or have grassroots advocates that are wanting to go deep into the legislative advocacy process, and I should say and, not or. Both legislation has been attempted, perhaps succeeded, and we want to keep the momentum, or advocates are interested in doing this work and they need more support. We have identified these 5 states. So I'm going to quickly talk about each of the 5. And again, we really want to encourage and not limit other states. We know there are some of you on the line from various states to know that we'll still be here, but we are specifically supporting these 5 states for the reasons I mentioned earlier in a real hands-on way as needed. So Texas introduced 3 bills last year. 1 passed, and Texans Care for Children is the leading the nonprofit that's been leading those efforts, which is really exciting to make that connection around child development. We know it's a powerful one that helps us really move the needle and get attention from other parties that may not otherwise think about maternal mental health. We also like to point out that Texas has 5, maybe 6 actually, of the 20 top cities or regions for postpartum depression risk. And Houston is the #1 hotspot in the nation. There's been a stakeholder meeting that we held in partnership with the local organizations in Texas. And from that meeting, there has been an interest expressed in potentially running a maternal mental health task force, and we'll talk about what that is in a moment. Arizona, Phoenix is the 2nd hotspot in the nation, and Arizona attempted some legislation last year that would have formed a maternal mental health task force or commission, and has an active coalition that's being led by ACOG in Arizona as we speak, that's working on a declaration to declare May Perinatal Mental Health Awareness Month or Maternal Mental Health Awareness Month. The language is still being worked out, but May will be noted as Maternal Mental Health Awareness Month. And this is always a great first step. We know that that one of you just asked if we want something easy, that's an easy win and a good way to get the attention of the legislature to start thinking about this topic. This is always a great first step to declare the month of May Maternal Mental Health Awareness Month. So Florida is on the list, and all I'm going to say is Florida is now looking at a comprehensive bill, which we're going to hear Lauren discuss with me in more detail in just a moment, so we won't spend more time on that. Illinois actually just had a law passed, and for many of you may not know what infanticide is or the link between infanticide and postpartum psychosis. We're happy to go into that in more detail with any of you who want to know more, but this is a very exciting piece of legislation that, again, has already passed 2 months ago, and we're really interested in continuing the momentum around maternal mental health in Illinois. Illinois was one of the leading states to address maternal mental health in a pretty robust way through legislation about 10 years ago now, but there's still more work to do, and we'll talk a little bit about Illinois and New Jersey and really what was in place as a screening mandate in those states and then what the research shows, and just a quick peek at, what we're learning is that mandating screening doesn't lead to improved outcomes or improved treatment, or even improved screening rates for that matter, if there's no way to monitor whether screening is occurring. And then California had a white paper produced earlier this year on maternal mental health from its state task force or commission. And there's currently an open telepsychiatry bill, and I think my colleague from the March of Dimes might be on the phone as well. We're sort of looking at whether or not that bill is going to help us move things forward in California, or if there might be other opportunities. And so we're happy to talk a little bit more about that in a moment. We also like to point out that Los Angeles in California is also in the top list of postpartum depression hotspots, as I like to call them. There are a couple other states that are addressing maternal mental health, most notably Pennsylvania. They are well staffed and supported and are going to have great success, I think, with or without 2020 mom support. So they're not a priority state for our organization, but I do want you to know that they're doing great work. The other state in the same boat is Maryland, and Maryland also ran a task force and a commission this year, and has had success in passing several pieces of legislation addressing provider education and more. Thank you so much, Stacy. So we can, we can go back to the slide you were just on. So we're going to talk a little bit about, Stacy, you can go ahead and advance. So state best practices. So a couple of you asked this question, and I want to, and actually before I go into state best practices, a couple of you are now asking about the priority state or the postpartum depression hotspot and how to find out what those 20 states are. I think we've been wanting to do a webinar with Sage Therapeutics in January on that topic, and we're having some difficulty locking down the webinar date, but what we will do is we will promise a blog post on those top 20 cities or regions if we aren't going to do a webinar in January. So hang tight and know that that's coming. There are some technicalities around the work that they're doing to publish their study, which means we can't share a whole lot, but we can share a little bit. So we will keep you all abreast and know that that may serve as leverage for you to do great work in the communities around advocacy. So great question. And we will tell you more about how those regions or those hotspots were identified, but essentially through risk factors. So there's another piece of research that was published by Deepika Goyal and others around risk factors that are available through census data, like single marital status, age, and income levels, for example, education attainment, that kind of thing. So not perfect. There are other factors, of course, in predicting risk, but it's something to start with, which is why we're all very excited about their work. Great, so let's move on. I do see some more questions, and we'll get to those in just a moment. Thank you all for the great dialogue and interest. So let's start with state best practices. And again, this is just a highlight. We also do have a PDF that we're going to circulate to all of you in a follow-up email with today's recording that goes into all of our recommendations. It's a 2-page overview for states in more detail, so take a look at that when it comes out. But we want to give you a little bit of some insight and highlights to start. So as I mentioned earlier, with great question that came in is, like, if we're new to this and want to rally our colleagues and professionals and survivors in our community or state, where do we start? And the easiest thing to do and have a little success is to do what Arizona is doing right now and many other states have done, and that's to declare the month of May Maternal Mental Health Awareness Month in your state. Usually, the way this works in each state is it's not a bill or a piece of, it is a piece of legislation, but it's a declaration or a proclamation, not legislation, so it doesn't become law. It just declares the month Maternal Mental Health Awareness Month. There's no funding needed, and generally it sails through, and it's a great way to kind of grease the wheels, if you will, and piquing legislators' interest in this topic. And we know it's a really prime time for this field since it's emerging and gaining traction nationally. So it's a really great way to start. Those that have already done that kind of a proclamation work or want to go deeper right away and haven't had a state declaration, what we really are advocating for, and it's not easy work, but we really encourage, because there is a lot to know about this topic, right? The range of disorders, how they vary, that it's not just postpartum depression, how women are impacted, cultural nuances, stigma. There's a lot to learn, and there's also, it's a complicated process for change. And so often what we find, and your head probably goes here too, just like mine and everyone else when we first got into this work, and New Jersey and Illinois, for example, years ago, right? What we often first think of is, okay, all we need is a public service announcement and a mandate to screen, and this will go away. So, for OBGYNs and others to screen for these disorders. Well, the problem is much more complicated than that, and that's what we want commissions or task forces to learn together. We also know that the beauty of forming a commission or a task force is that it, as you can see, this first line that's indented funny, is it gives you, again, an opportunity to learn together and get educated on the range of disorders and the barriers, which are plentiful. And it really points to why this hasn't been solved for yet, that it must be complicated, and it is. But bringing together these multiple stakeholders, so usually these commissions, blue ribbon commissions, or task forces are formed with about 20 people. You can see numbers increase or decrease, but generally, 20 people or so. We like to call it following the Harvard Business School two-pizza rule, that if you have too many people at the table, that two pizzas won't feed. Two large pizzas, then you have too many people to really make decisions, which these commissions and task force need to do, and that's not just learn together, but also develop a plan of action and publish that state strategic plan. So you can see the last line there under blue ribbon commissions and task forces is that a blue ribbon commission is generally funded by the public, so state funded, and would require a piece of legislation that would authorize usually one state agency like the Department of Public Health or Department of Mental Health, for example, to facilitate contracting with someone to run the commission or run the commission themselves, but earmarks some funding for them to do that. What we found is both the California, the most recent commissions, were called task forces. The Maryland and California task forces were actually privately funded, but both Maryland and California had a resolution similar to what is used to declare the month of May Maternal Mental Health Awareness Month, a resolution that went through the legislature to say this topic is really important, and we think that a task force should be formed that can be privately funded, and then that helps organizations go back to private foundations, healthcare foundations usually, or foundations working in early childhood, to say, yes, we believe the same thing the legislature believes, that this is important, and we want to put some of our money behind creating a strategic plan in the state. So that's how that has worked. And again, we really think that this is a great first step or second step after a declaration of May as Maternal Mental Health Awareness Month, because it acknowledges the importance of understanding the multiple barriers and multiple complexities of these range of disorders, that there is no simple solution, and it requires multiple minds at the table, multiple experiences, etc. And then you have automatic champions in your state for any legislation that's introduced going forward, or even efforts that don't require legislation. For example, in California, there's efforts underway with the Department of Healthcare Services, the Medicaid agency, to do some work that won't require legislative efforts, perhaps. So just a great way to create champions. The last a couple items here that we know that there's some opportunity for people to get engaged in their own states. This third bullet here talks about the opportunity for advocates in their states, if there isn't a maternal mortality review committee, to actually work with other organizations that are potentially leading efforts around maternal mortality review committees, consistent with what we say, suicide tracking, or the federal advocacy platform that we talked about earlier. So an easy way for advocates to say, this matters to me and this is why, and I think it's critical that suicide be tracked in our state, and we can't do that without a maternal mortality review committee. And then I would just also say that there really is an interest and an acknowledgement that what we must do first in every state is ensure adequate treatment availability and support for providers. And I think, Lauren, when we hear from you and do our little interview here in Florida, we're going to talk a little bit about this. But I didn't yet acknowledge Massachusetts as a state really who, I think it's safe to say there's only one state, and mastered might be too strong of a word, but only one state who's doing this work well right now, and it's Massachusetts. Massachusetts had a child psychiatry access line that they were able to build a maternal mental health psychiatry or reproductive psychiatry access program kind of on that same chassis in an effort to address the fact that there is a shortage of maternal mental health support in Massachusetts, just like there is everywhere else in the country, which is really one of the reasons why screening does not happen, right? Because OBGYNs or other providers just don't know who to refer to. There's lack of psychiatrists in particular if drug treatment may be warranted, and so providers are afraid to screen if they don't know what to do with the most difficult cases, or cases that need where women may need and desire a drug treatment. So really we wanted to acknowledge that telepsychiatry and then training programs for providers, capacity building programs for providers, like case management support that can be provided through insurance carriers. All of these things are critically important and really must be lifted up as a best practice to build up treatment. Super. So we are going to move on to the next page. Before we jump into Florida, though, we will pause and answer some questions. Okay, let's see. So somebody is asking if 2020 Mom would be willing to list advocacy organizations who are doing work in their own states and perhaps following the 2020 Mom recommendations. So I am going to get to a new opportunity that we'll talk about at the very end of today's webinar, which is a learning network for state advocacy that we'll be launching. I won't go into the details right now, I'll save them, but I think this will help. This learning network is going to help identify, and hopefully we'll see some of these organizations bubble up. I will say that the March of Dimes, who I think is on today, and listening to the recording, as well as ACOG, the American College of Obstetrics and Gynecology, are really two national organizations that have state support in place through formal lobbyists, are really going to be backbone organizations that help support and drive drive this work in all states. So we'll start with that and know that there's going to be many more organizations and local maternal mental health groups, including Postpartum Support International chapters where they exist in some states, that will be interested in going deeper with all of us on this topic. Let me just make sure we don't have any other questions that we haven't addressed yet. Great. I think we have gotten to all of the questions, and thank you, Sean and others, for the positive feedback you're sharing. Super. So just a reminder that the best practices are listed in more detail on a PDF that we'll be sharing later when we send the recording out for today's session. So I'm pleased now to get to introduce Lauren DePaola. Lauren, as you can see on the screen, is a licensed clinical social worker, and she also is in private practice. She lives in Gainesville, Florida, and she's the founder of both the, and you know what, you'll have to pronounce your county name. I'm afraid I'm not going to say it right, Lauren, but you'll have to tell us again. Alachua, I think. Alachua, I knew I was not going to say that right. County Perinatal Mental Health Coalition, and also has helped form the Florida Maternal Mental Health Collaborative in 2016, which we're so excited and proud of you for doing, Lauren, and has really been the champion behind, working alongside many other clinicians and survivors, but convening stakeholders throughout her state, and now helping to launch and get off the ground Florida's very comprehensive piece of legislation to address maternal mental health, which is called the Family's First Act. And you'll see on the top of the slide that you can look at now that we have attached the fact sheet, the one-page overview of the Family's First Act for all of you. You can open it up using that gray bar on the control panel. We'll also make sure that you have access to this when we send out the recording link, so you'll have access in another format as well. But if you'd like to take a look now, you're welcome to. It'll go ahead and open up in another window for you to look at. So I have the pleasure, and this is what we've been experimenting with, and we'd love to get your feedback on this layout, but we now just want to, instead of looking at some slides from Lauren, we're going to just have a casual conversation. We call these craveable conversations because we know everyone's interested in hearing from these great people that we often have the pleasure to connect with. And so, Lauren, let me just first ask, can you tell us a little bit about what brought you to this work?
Sure. I think I'll start first by saying that the disclaimer that related to policy, I have no formal background or training. And so this has been such a huge learning curve and honor to be a part of. But so what initially brought me to this field is an experience of postpartum depression, a personal experience with that. And I'm a licensed mental health clinician, and no education was given surrounding reproductive mental health or perinatal mental health specifically. And nothing at that point in time was really existing in Florida. Thankfully, my symptoms were mild, and I was able to hook up with Postpartum Support International, which is a godsend for many people across the nation and the world, and was able to get telehealth services actually from out of state. And so once recovered from that, really found my passion and received additional training, did a lot of sort of personal development and research myself as well. So that's great, very beginning.
Yes, thank you so much, Lauren. And much like I think several of you, or many of you perhaps on the phone, who have become engaged in this field and become clinicians or were clinicians before and now go deeper in maternal mental health, have had personal stories. So Lauren, thanks for sharing that, and welcome. We're so excited to hear about your work. So let me tee things up just a little bit by sharing that Lauren was you, I think, may have approached the legislature and or a legislator who we'd love to learn a little bit more about, may have approached you and had personal experience herself, and also has an interesting background that perhaps put her at higher risk. But it sounds like she,
right,
the author of this bill, and then the corresponding, I think, Senate bill, it is a real mover and shaker. Will you tell us a little bit more about your champion in the legislature?
Sure. So the process leading up to that, the local coalition here in Alachua County did, from what we know, the first community study on maternal mental health, and this was with some guidelines from 2020 Mom as an early adopter. And then once we had our findings report in April of this year, I wanted to make sure I shared it with people who were decision makers in the state. And so Senator Lauren Book, who is from South Florida, represents part of Broward County, Florida, is a freshman senator. And she responded almost right away to an email that I sent her, which was surprising to me that she responded that quickly or at all. And she had just not too long ago had twins, so given birth to her first children, and was very open and is open publicly about experiencing postpartum depression. And the risk factor in her childhood, she is unfortunately a victim of sexual abuse. And so has been a huge champion in our state for really shining light on advocacy and prevention against childhood sexual abuse, and has been an advocate for many things related to women and children. She also did a bill for eliminating the tax on diapers and feminine products as well. And so she got a hold of our findings report, and I've been just so thankful to have the honor of working with her and her staff, as well as my co-founder with the Florida Collaborative, Dr. Heather Flynn, to really inform them of the research, best practices, what other states have done who have gone before us, and draft this bill that she filed in August of this year.
That's fantastic. Thank you for sharing that. And you said her name, Senator Book. Is that right, Lauren?
Senator Lauren Book, yes, Lauren Book, B-O-O-K. Mm-hmm.
Yes, great. Good. Thank you for that. And I think it's nice to hear a little bit about who are the champions in other states, so that as we think about approaching folks in our own states, we know what that profile looks like. So this is just one person's story, and she sounds like a really powerful advocate on so many levels. So thanks for sharing that, Lauren. And also, Lauren did point out that even though there wasn't a formal piece of legislation that led to Florida addressing and creating a state strategic plan, she used one of the tools in the 2020 Moms framework of tools to create a strategic plan. It's actually a community action toolkit, so really developed initially for local communities to go deep on this topic, but can be used at a state level too. So that's another way to go at this and share a report. And I know, Lauren, you had brought multiple stakeholders to the table when you developed your strategic plan as well. So just another great reminder that bringing multiple people together to study the topic, issue a report, and then send it to the legislature is a really powerful way to address the problem. So thanks for reminding us about that too, Lauren. Well, let's jump into the meat of the bill. I don't think we've seen a comprehensive bill like this. The bill text itself is pretty short, which hopefully will help that piece of legislation, kind of cruise through the legislative process, or maybe it won't. But right, but it is pretty. It looks to solve for a lot of things. And so let me highlight the three things that jumped out at me, and then love for you to jump into those as well, and then we'll take some questions. So you acknowledge the need for what we called earlier sort of this increased provider capacity, that doctors can't do this alone especially without support to qualified providers, and how to connect with qualified providers and reproductive psychiatrists So I noticed in the bill that there is a provider warm line or hotline. We also have a patient warm line and hotline. So we want to hear a little bit about that as well, and then also a advocacy public awareness campaign. And Lauren, I'm all of a sudden forgetting the third component, but it's comprehensive. Remind us of that third component. Oh, the hospital screening. I'm sorry, the hospital and birth center screening protocol. And so let's start by talking about the warm lines and the hotlines for providers.
Right. So when I was speaking with Senator Book, along with Dr. Heather Flynn, we really wanted to impress the importance of going for this from two veins, and one was from the provider side and one was from the patient side as well, because we just always hear so many barriers from both ends, both primary ends. And so the hotline for patients is, and all of this in the bill, you can look at the language in Florida legislature, really addresses the Florida Department of Health to have the awareness campaign to the public service announcements, and then to run the patient hotline and the provider hotline. And so the patient hotline would allow for anyone toll-free to call in. The number would be on the public service announcements, also through social media, not just on TV, since many of us aren't really looking at TV as much anymore as we are social media. And would have, one thing that we didn't mention was, would have directions to get to the clearinghouse. So the Department of Health has also been directed to keep a statewide clearinghouse of mental health providers with the specialized training in perinatal mental illnesses. And so the Florida Collaborative has begun to compile that before this bill was even submitted. And then from the provider side, it's much like you explained earlier about the wonderfully effective program up in Massachusetts. And so one of the things that Dr. Flynn and I did to give Senator Book as much information as we could was just speak to other states and the advocates in those states who had gone before us or were in the midst of the outcomes of their bills. So certainly Dr. Nancy Byatt up in Massachusetts was one of those people, in addition to folks who had helped them get that started. What we learned from that, though, is that it's extremely expensive to have a provider hotline staffed by psychiatrists. And they're a much smaller state than Florida. And so we'll talk, I'm sure, in a little bit about any pushback that we've had, but it's in this area of staffing a provider hotline, so that any medical provider, primarily OBGYN, pediatricians, primary care doctors, can call in and say, what do I do next? And kind of curbside with best practice information, what to do next, and then to also direct them to the clearinghouse of providers for their local resources.
Great. Thank you for that. So it really is just an entry point to receive the information that may be available about providers who are in the state, including reproductive psychiatrists, but not to actually staff and provide provider-to-provider consult in reproductive psychiatry.
Right.
Got it. Great. Good. I see a question that has come in, and I think we'll stop and take it here before we move on to the other components of the bill, Lauren, because it's on point. And that is, Amanda's asking, do we know of any states that are utilizing their 2-on-1 services to kind of serve this need? I would think specifically for patients, and that directories are provided and maintained by 2-on-1 services, perhaps in connection with a community-based organization, maternal mental health organization in their states. And so I know one example of that, or two examples of that I would like to share, and I think it's a great question, and that is oh gosh, it's not the state of DC, whatever we call DC, and I think we've got some folks for DC, the District of Columbia, not the territory, that would be Puerto Rico, but DC, Washington DC has maintained a 211 directory in connection with their ongoing collaborative work there as well. And so has the County of Los Angeles, which is the size of the state of Massachusetts, so really could be a state in and of themselves. They also have partnered with their County 211 program to provide this information to women when they call and promote the use of that. They also maintain a directory online. And of course, Postpartum Support International attempts to do this too through their warm line. There's no published directory, but I know we've got some folks on the line from PSI who are assisting with state chapters and the work that they do. So I think it's a great opportunity. Amanda, thanks for the good question. And Lauren, I don't know if you have anything you want to say relative to Florida and any 211 programs that may exist and how these hotlines for women in particular might eventually sync up to the 211 program.
No, I think that's a wonderful idea. I know locally, our local coalition is connected through 211, but statewide, no, that hasn't yet been addressed. I think that's a wonderful idea.
Great, good. Let me just make sure we don't have any other questions that have popped in on this topic or comments, and then we'll move on to talking about the you know what, let's go ahead and move on. It doesn't look like there's another question, Lauren. The public awareness campaign, and tell us a little bit more about that. You said that the State Department of Public Health will be responsible for social media and perhaps some television, and we've seen in other states there's like bus wrappers and bus sign, bus stop inserts by bus benches, which all public folks driving on the streets can see, for example, billboards. Tell us more about how much funding is being earmarked, if you know that yet, and what that might look like. And it sounds like it'll probably refer people back to the newly formed state hotline for patients.
So the funding has not yet been earmarked. We are awaiting for this bill, which is filed for 2018 session, to go through the committee process, and then finally end up talking about dollars. And so it really looks for the Department of Health to create the announcements to, for education purposes. And so as far as dollars yet, or specifically, where these announcements will be deployed, we don't have the particulars on that yet. One of the things that, right, that'll be up to the department.
Great.
I will say one of the things related to just public awareness campaign, just to help others who may be sort of looking at what their state can do. In Florida, one of the things that we just launched and then are following up with continued funding through a media group in our state's capital in Tallahassee, worked with them to create a public awareness campaign on specific to perinatal mental illness, with statistics and where Florida falls as far as addressing with legislation and the effects of not addressing this. And we worked with this specific group who had proprietary software to put it directly into the social media feeds of Florida legislators. And so we wanted really to target those, educating those legislators, and the results were quite a bit of reactions, the technical terms, reactions via social media, and has gained some steam as far as sponsorship support in the House and in the Senate.
I was going to ask that question next. So it's not directly on point with the public awareness campaign that the legislation would require, but is such a really interesting way that you're using social media to target legislators around advocacy. So we want to know more. Lauren, why don't you follow up with all of us, and we'll make sure we share it with all of you. Like who is this firm and what are they doing? It sounds fantastic. If any of us are doing some legislative work in our own states, that might be a good use of resources to make sure that legislators' social media feeds kind of have pop-ups about maternal mental health routinely, so that they know that they need to think about this bill. So I love that. Thanks for sharing, and it seems really cutting edge. Great. Well, let's now talk a little bit about, and keep the questions coming. I see a couple more, but we're going to stop and talk a little bit now about hospital screening. And Lauren, I don't think I'm going to put you on the spot, because I think you and Dr. Flynn, who all of us that know her really have so much respect for her as well, have thought through this, and likely Senator Book has asked questions too. So people don't often think about hospitals as the best place to screen. We at 2020 Mom actually do think about hospitals, in that, you know, the research and evidence shows that the majority of women deliver at hospitals. It's 99% of women in the United States will deliver at a hospital, even if they use a midwife, and home births are rare, or birthing centers outside of the hospital infrastructure are rare, even if we want to make sure that women always have access to those opportunities. So we are interested in scaling change through hospitals, very interested in scaling change through hospitals because of that reach. But generally, people think about, especially if their minds are on postpartum depression, right? Think about either OBGYNs in the postpartum period or pediatricians. And those that have studied this know pediatricians can always be a little bit tricky, because the patient is the baby, not the mom, and there's privacy issues and billing issues and other things. It doesn't mean that they shouldn't still screen. Or those that know that these disorders occur as often during pregnancy, and that there are pre-existing conditions and disorders prior to pregnancy that still need to be treated, often point back to the OBGYN as the place to screen. So to tell us, to detect during pregnancy, or even prior to conception if possible, tell us why hospitals.
So, part of our discussion and just looking at best practices and research speaks to some of what you just said. And so the Senate Bill 138, and now our corresponding bill in the House 937, really speaks to what's already in some form taking place at both hospitals that have, that are birthing centers, as well as birth centers in Florida. So it may be where midwives or midwifery are delivering babies in a birth center, freestanding birth center. And so those folks are already required in Florida to address postpartum care for their clients. So they do the physical examination, obviously, of mom and infant, and different screenings. And so it seemed natural then to attend to the mental health as well for those patients before discharge. And so it's not simply a screening, because I think you mentioned earlier in the webinar that simply screening has not shown by literature and studies to be effective on its own. And so it's really the discussion, incorporating mental health as part of the discussion, doing a screening, and then in those packets that those of us who have delivered in a hospital or birth center that we're sent home with, it's also including information about what we hope to have, for a patient hotline, the clearinghouse of providers, and educating whoever that support person is with that mom as well before discharge. And so it updates part of statutes in Florida that are already in place.
Fantastic, and really helpful point of clarification. And it sounds like this may be pretty unique to Florida. I don't know if other states are doing something similar where there's this already, model or infrastructure in place for postpartum care to be delivered through hospital settings. It sounds pretty forward thinking and a great chassis to to link this work onto. Great. Lauren, thanks for that explanation. Let's move on to any other questions that people have. I think, Lauren, what I want to say is that I think your story and the work that you're doing, and having had no prior legislative advocacy experience, is really great, because it shows and reminds all of the advocates in our network that you don't have to be an expert. You need to have expertise in the topic, but not in the legislative process. That champions are going to help you through that, and that really what's needed in the legislative process is your voice as experts in this field, as survivors, as people who have stories. So thank you, and I just wanted to acknowledge that.
Thank you.
Let's see if there's any other questions coming in. And Lauren, what we'd love for you to do between, as you progress through your process, is to keep us in the loop. And the funding piece of the bill is really of interest to people, and that it sounds like the fiscal committee is going to help kind of look at all of that and put a proposed price tag on the bill. And we hope that that's not going to slow things down. One of the other questions we wanted to ask is, what are the anticipated pushback? Like, what groups are going to push back a little bit? Have you already heard from those groups? Why don't we talk about that now?
Well, we haven't yet heard specific. Let me preface that by saying one of the initial pushbacks that we heard rather quickly in the initial bill, initial filing, initial draft, whatever we want to call it, there was language saying requiring those providers working with perinatal women, requiring them to have continuing education on perinatal mental illnesses. And so we heard both from those providers as well as from some of the committee members that the term requirement was probably not going to be met with support. And so that first is not surprising, but has been modified to be encouraging those providers to have continuing education. And one of the things that we are really pushing for the clearinghouse and that the Florida Collaborative is already doing is we have a form that says, would you like to be part of our provider list? And we have a map for mental health clinicians, for reproductive psychiatrists, for support groups. And so one of the things that we ask is, where did you get additional training? And so we're trying our very best to look at those programs that are most evidence-based to, quote unquote, vet those folks who we're going to be listing. And that's, not a standardized process throughout the U.S. yet. So that's been the pushback so far. The other pushback I think I mentioned earlier was just related to the dollar signs of how to staff a provider hotline with psychiatrists.
So you've heard some pushback and kind of addressed the bill already, and so no new pushback, it sounds like, since those modifications were made.
Not yet, and recently we've had, we definitely have ACOG in Florida, their support, and recently we've had formalized support sent or communicated to us through the Florida chapter of the American Academy of Pediatrics, as well as the Florida chapter of the National Association of Social Workers. And so that's leading up to, I don't know if you were going to ask me about our Advocacy Day in Tallahassee. So we'll have a great deal of support for that Advocacy Day.
That's great. No, I appreciate that. My next question was going to be, who's supporting this work, and how is that going to get others engaged? And you addressed that. You are going to have a Advocacy Day, it sounds like, and it'll be special to this work and have some partners that join you. Well, let me go ahead and pause and Lauren, just ask you for any final thoughts on the work you're doing in Florida, anything you would want other advocates to know, or nonprofit organizations that are already engaged in advocacy to know. And then we're going to go ahead and start to wrap things up. And if you do have any final questions, those of you listening in today, feel free to use the question box on the control panel to submit those questions. So Lauren, final thoughts from you.
Sure. I think one of the biggest pieces of advice that I have is just to, in some way, shape, or form, find the other advocates in your state. You know, maybe start locally and work out from there. And the Florida Collaborative really speaks to that by having representatives from different universities within the state, from our Healthy Start Coalition, from our Agency for Healthcare Administration, our Department of Children and Families, many different entities, other maternal mental health specific organizations that exist. March of Dimes here as well is involved. You mentioned them earlier, and just really being able to connect those already established organizations throughout your state who are already doing wonderful work in some way, shape, or form related to maternal mental health, and just kind of come out of each other's silos and create synergy across the state. I think that's been the biggest factor.
Awesome. Thank you for that, Lauren. And it does remind me, for those folks who may be on the line that attended the federal lobby days in DC for maternal mental health, we had talked about doing a session, a webinar on how to form a state coalition or state collaborative. Sort of ties nicely into this idea of forming a state task force, which is temporary. But Lauren, really what you've done is continue to convene collaborative members, hold an annual event every year in your state to keep the momentum going. And so I do think there's also another opportunity here for us to explore that and support other states in thinking about a collaborative, an ongoing collaborative infrastructure of some sort. So thank you for that reminder. And Stacy, we will make note of that. I'm going to just check the question box one last time, and it doesn't look like we have any more questions coming in. You can see on this slide before we advance, both of our email addresses are here. Feel free to email either myself or Lauren about questions you have about her work. Lauren, thank you for your leadership. You are an inspiration. It seems like this piece of legislation is actually comprehensive but simple enough because of the things that you've shared earlier. There's not a huge price tag associated with the legislation, and I know I learned a little bit today. So thank you so much for your work and for sharing with us today.
Absolutely. Thank you so much for inviting me. It's been quite the learning curve, and just been thankful to have your support as well.
Great. Well, thank you, Lauren. I know the conversation will continue. We'll continue to keep everyone else abreast. We're going to flip to the very last slide. Actually, there's 2 more slides, and then we'll wrap up for today. Stacey, if you can go ahead and advance. There you go. We just want to tell you a little bit more about where the opportunities are to get engaged in advocacy. If you are interested in going a little bit deeper and staying connected on this topic, we have a pending lobby day. The dates that we are tentatively, the congressional calendar was recently revised, and so we're now looking to change the dates of our lobby days and partnering with one other organization perhaps to do this work. And so the tentative dates now, which aren't even on our website because this just came up about this week, are May 6th and 7th in DC. You can stay abreast by staying engaged through our e-newsletter, which I think you all have access to, and that's how you found us. You also have an opportunity if you want to stay connected on maternal mental health in a broader way, not just with advocacy. There's our ambassador program, and we have folks who are doing great work in many meaningful ways, even at a city level and a community-based level. You can connect with them and learn about ways that you can go deeper in your own community through the ambassador program, including, you'll see that last purple line, connecting with local elected officials. And we talk about how to do that and have webinars for our ambassadors as well. So state and county officials as well. And then finally, you'll see that we have e-news sign up and a Facebook page, Twitter, etc. Our website has all of that. And Stacey, let's end on that last page, which is just a reminder. I hinted at the fact that we have a, Stacey, you can hit advance one more time, and up on the right corner, you'll see that we're launching an advocacy learning network so all of you can stay connected with each other, share what's happening on your legislation, ask for advice. We'll do webinars occasionally that will be available just to those who join the learning network, some like this that will be available to everyone, but really want to make sure that you're well supported. So I look for more information about that. Again, that network launches this spring. Thank you so much, everybody, and we will be asking for your feedback and sending out the recording today in a follow-up email. Thank you again, Lauren, for joining us. Stacy, as always, for being by my side. And everyone, stay in touch and know that there will be more webinars and ways to engage that come out shortly. Thanks all, and happy holidays.